Hello, good day, Miss Mary Grace Obdulia Amok, RN. My name is Joshua Go from Bachelor of Science in Nursing. Level 4, I am Section A. I am here going to demonstrate the seizure precaution. So what is seizure precaution? Seizure precautions are designed to protect the patient from injury or if the patient is need to reduce the environmental stimuli that may trigger the onset of the seizure. The purposes of this one or two purposes of this procedure is number one is to protect the patient from injury. Secondly is to reduce the environmental stimuli that may trigger the onset of the seizure. So materials that are only needed in the procedure are you need a blanket or other linen pad, side rails, no, and then oral section and equipment. You also need oral airway, oxygen equipment. So as a nurse, we are following the basic guidelines of the nursing process: assessment, planning, implementation, evaluation, documentation. So for the procedure proper. So for the assessment, we're going to assess the history of the seizure. If the patient have so detailed informations like the characteristics of the seizure and the aura of premonitory symptoms that indicate the seizure in the beginning, and then also duration and frequency of the seizures, the consequence of the seizures, for example incontinence or difficulty of breathing, and then the actions that should be taken to prevent prevent or reduce the seizure activity. What you have to do to prevent this one. And then also you gather the equipment and materials to save time, effort, and energy. For the implementation, this is how it is done. So the first thing we're going to do is to explain the client what is seizure precaution is all about. Wash your hands and observe appropriate infection control procedures. If the client is actively seizing, apply clean gloves in preparation for your performing the respiratory care measures. Provide for client a privacy, and then pad the bed, secure the blankets or other linens around the head, foot, and the side rails of the bed. And then place oral suction equipment in place and test to ensure that it is functional. If a seizure occurs, remain with the client and call for assistance if needed. If the client is not in bed, assist the client to the floor and protect the head in your lap or on a pillow. Apply oxygen by mask and then turn the client to lateral position if possible. Time the seizure duration, move items in an environment to ensure that the client does not experience injury. Observe progression of the seizure, noting the sequence and type of limb involvement. Observe skin color. When the seizure allows, check pulse and respiration. Administered ordered anticonvulsant medications. And then use equipment to suction the oral airway if the client vomits or has excessive oral secretions. When the seizure has finished, assist the client to a comfortable position. Provide hygiene as necessary. Allow the client to verbalize feelings about the seizure. And then for our evaluation, we're going to evaluate the client's vital signs and the overall status after the seizure, and then to evaluate the effectiveness of the procedure or the seizure precautions being implemented by the patient. And then for the documentation, we document the time of the seizure started, the duration of the seizure, accurate description of the seizure, the pertinent your observation to the seizure precautions that is being employed. And then so ambulatory and community settings. So there are things that we don't do and don'ts, and then after the seizure. So the first thing we're going to do is the do. So what are going to do if we see the patient is seizure? Do gently roll the person in one side and then put something soft under the patient's head, like pillow for example, or anything that is soft, and that do loosen the tie wear of the patient. Do not move dangerous objects if they're so, like furnitures. If the person is moving, do time of the seizure and observe properly, and then the person closes so that it can provide details about the event, and then do also to keep calm and reassure others nearby calmly. You do calm, to do also to call an ambulance if the person is injured or has another seizure without fully recovering from the first seizure or the second seizure, for example. So there are don'ts also. Do not try to put your fingers anything else in the mouth. It is physically impossible for someone to swallow his tongue, during the seizure. So also do not try to restrain someone if having seizure And then also don't attempt to rouse the persons by shouting or shaking him or her. And then don't leave the person until medical personnel arrives. Okay? And then after the seizure, allow the person to lie quietly as awakened and gently call them by name and explain what happened and where they are. It is not cause to alarm the person urinates or has a bowel movement during or after the seizure. And then if the person has an injury, make sure that such heavy bleeding from the tongue, call an ambulance, then write down the accurate description of the seizure as soon as possible. So use a nurse, that's the things that you're going to do if there's a seizure. So that will be all. Thank you so much.